Today we will be talking about dysgerminoma, and we will be using a Mnemonic to remember the morphology, the IHC, and the genetics of dysgerminoma, so that you don't have to forget ever again. And it is a birthday party, so a birthday party is going to help us remember all the points. So first of all, the name dysgerminoma comes from the word germ, which means germination, and that will help us remember that it is a birthday party. And whose birthday party is it? It is Sally's birthday party. It falls on October 3rd and 4th, and all her friends are invited who are lymphocytes, and they have got gifts for her, and all of them are clapping their hands. Somebody is taking a photo of her using iPhone 12. Her cake is in the shape of a fried egg. She is wearing a pink dress, polka dot pink dress, and one of her friend is missing. In every birthday party, there is somebody who is missing, who doesn't come at the last moment. So that is the missing friend. This is just a normal birthday party like any other birthday party, but every point is going to help us remember something really important for our exams. So let's begin. So first of all, we know that from the word dysgerminoma, we have to remember a birthday party. And this is the image. Lock this image in your memory. This is the image you will remember, which will help you remember everything ahead. So first, let's talk about the morphology. So as you can see that these cells are polygonal, large, having clear to eosinophilic cytoplasm, just like Sally's dress. The pink polka dots will help you remember that they are uniform cells having clear to eosinophilic cytoplasm, a central nuclei, and a prominent nucleoli. Then in the background, we have lymphocytes. Just like Sally's friends, they are present in the background, and we have our lymphocytes in the background, and they are separated by fibrous septae. So there are different groups of lymphocytes here, and they all are separated like they are separated by fibrous septae. So this was about morphology. Now let's come to the IHC. So IHC first is Sally. From Sally we will remember SAL4. So dysgerminoma arises from the primitive germ cells, and SAL4 is positive, and it shows that that is from germ cell lineage. So that's number one. Number two is OCT3 and 4. When her birthday falls on October 3rd and 4th, that OCT3 and 4 is a marker of pluripotency, and therefore it will help us remember that dysgerminoma arises from undifferentiated cells. Then the third is that her friends are clapping. From clapping we will remember PLAP. It is a supportive IHC marker. Positivity of PLAP supports that the diagnosis of dysgerminoma. Then few of them have got gifts, and these gifts are, so kids going to say that CD117 or C-kit positivity is seen in dysgerminoma. Now last, coming to the genetics. So we saw that there is iPhone 12, so isochrome 12p is positive in dysgerminoma. So basically it confirms the germ cell origin at the genetic level. So if there is isochrome 12p abnormality, we have to think of germ cell tumors first. Okay. And yeah, finally the missing friend. Who is the missing friend? It is AFP. So AFP is missing here because AFP positivity shows that it is of yolk sac differentiation, and it is seen in yolk sac tumor. AFP is not elevated in dysgerminoma. So AFP is missing.